Hello and welcome to today's lecture. I'm Ibulani and I'll be guiding you through today's topic. In this session, we'll be focusing on nursing management for patients with hypertension. I hope you've read your textbooks before you watch this video. We are going to review and deepen your understanding about the topic, and this lecture is designed to give you clear, practical insight that you can use. We'll walk through the key concepts step by step with examples and explanation to make things as straightforward as possible. So please grab your notes, settle in, and let's get started. Okay, next, before we begin, let's take a quick look at our learning objectives for this session. These objectives will guide our focus and help you to understand exactly what you're expected to learn and take away from this lecture. By the end of this session, you should be able to understand the pathophysiology and medical management of hypertension. Second, you are able to formulate an appropriate and systematic nursing assessment, diagnosis, intervention, implementations, and evaluation for patients with hypertension. Okay, let's start. Here is the critical points to remember related to the hypertension, but let us start from the basic. So, every moment your heart is hard at work, pumping blood through a vast network of the blood vessels, delivering oxygens and nutrients to every cell in your body. The force that keeps this life-sustaining circulation going, it's called blood pressure. But blood pressure is more than just numbers on a cuff. It is a delicate balance that reflects how well your heart is working, how wide or narrow your blood vessels are, and how much fluid is in your system. So, what exactly is blood pressure and why it is so important? Let's break it down. From the definition, blood pressure is the force exerted by the blood against the walls of vessels. It must be adequate to maintain tissue perfusion during activity and rest. BP or blood pressure is mainly function of cardiac output and systemic vascular resistance. The normal blood pressure is defined as systolic BP under 120 and diastolic BP under 80. Hypertension can result from either primary or idiopathic or secondary uh, or specific cause of a disease. Next, we are going to dig more about the factors that may be influencing the blood pressure. Blood pressure is determined by two main factors, the cardiac output and systemic vascular resistance. Cardiac output is influenced by the heart rate, contractility, and conductivity, all controlled by the cardiac system. The heart rate is how fast the heart beats. The contractility is how strongly the heart muscles contracts, and the conductivity is how efficiently electrical signals travel through the heart to trigger contractions. These cardiac functions are crucial in maintaining the amount of blood being circulated throughout the body. And also there are another mechanism. The renal fluid volume control also plays a major role through the renin-angiotensin-aldosterone system and natriuretic peptides, adjusting blood volume and also blood pressure. Meanwhile, the systemic vascular resistance is shaped by several mechanisms. The first one is the sympathetic nervous system. There are adrenergic receptors that can cause vasoconstriction and beta 2 receptors that can promote validations. The second mechanism is neurohormonal factors like angiotensin and norepinephrine, which act as vasoconstrictors. The next is the local regulations. It is involving vasodilators like prostaglandins and also nitric oxide and vasoconstrictors like endothelin. All these systems work together to maintain normal blood pressure. However, when one or more these mechanisms become overactive or defective, hypertension or high blood pressure can develop. Next, when everything is in sync, blood pressure stays within a normal healthy range, ensuring that the organs gets exactly what they need, whether you are sprinting upstairs or resting on the couch. But when this balance is disrupted, when blood pressures become too high, it can silently damage vital organs over time, leading to serious complications like heart attacks, strokes, kidney failures, and even blindness. Here are the common complications for hypertension as you can see on the picture. For the organs, especially the eye, it can cause the narrowing of retinal arterioles, hemorrhage of or exudates, papillodema. For the brain, it relates with the stroke, transient ischemic attack. For the heart, it's really related with CAD or coronary artery disease, heart failure, and also left ventricular hypertrophy. For the kidney, it can cause microalbuminuria, proteinuria, and also serum creatinine under 1.5 milligram per dl. In the abdominal, it can relate to aneurysm, and also for penis, it can relate it to erectile dysfunction, and for the peripheral vascular, it can cause um, claudication and also faint and absent peripheral pulses. There are the common complications related to the hypertension that you need to understand. So as a nurses, you know that your patient have the possibility to have all these complications if the hypertension is not treating well. Okay, next, we've come into the interprofessional care for the patient with hypertension. Like you learned before that interprofessional care is combining clinical expertise, continuous monitoring, patient education, and coordinated follow-up. It is offered the most effective and also evidence-based approach to manage hypertension. So, from the medical management point of view, it will start usually with diagnostic assessment. You can see the physician will take the history and physical examination, and also including ophthalmic examination that related with the common complication. They will also examine the blood glucose, take the routine urinalysis, basic metabolic panel with EGFR. It's really related with the kidney function, complete blood count, serum lipid profiles, serum uric acid, and also 12-lead ECG. It is really important for you to understand what kind of diagnostic that the physician has, because actually it is it's all related to the complications and also how far the hypertension goes for the patient. It's really important for you to understand the pathophysiology of the hypertension, because it's of course the main cause why the physician need to take the diagnostic assessment. And also the physician may take optional assessment like 20-hour urinary creatinine clearance, echocardiography if it's related to the cardiology, or maybe left ventricular hypertension, or CED, or heart failure, and also liver function studies, and also serum thyroid stimulating hormone or TSH. For the management for patient with hypertension, usually they will ask for periodic BP monitoring, they will ask the patient to monitor their BP at home, and also while in the outpatient department, and also every 3 to 6 months on a healthcare provider once goals BP is achieved and also stabilized. And also, they will ask for nutritional therapy to restrict the salts, sodium, restrict the cholesterol and saturated fat, maintain adequate intake potassium and calcium, and also weight management because it is really important for patients with hypertension to control the diet because it can impact the blood pressure. And also, they will ask for regular and moderate physical activity, tobacco cessation, moderation of alcohol intake, stress management, taking a regular antihypertensive drug, and also teaching the patient and caregiver about how to take care patient with hypertension. Okay, here is the main therapy for hypertension. This is the common drugs that use for patient with hypertension. They can use it on single dose or maybe in combination. It depends on the patient condition, of course. There are um, six main drug class, and also you can see in this table the mechanism, how it works in the body, and also the examples of the drugs and the possible side effects or consideration that you need to understand when the patient's taking these medications. The first class is thiazide diuretics. The mechanism of action is lowering the blood volume and also vascular responsiveness. The example is hydrochlorothiazide, with the side effects is hypokalemia, hyperglycemia, and also gout. And also, this is the most common high antihypertensive that patient use, the adrenergic inhibitors and also ACA inhibitors. They act differently with different mechanism, with also different side effects. It is really important for you to take a look at this antihypertensive drug and understand what are the drug classes so you can be the patient advocate when you see the patient taking more than one drugs and maybe it's not appropriate, then you can give some advices related to the therapy, and you can discuss with the doctors who make the um therapy for the patients. Okay, next we are going to nursing management for patient with hypertension. It is really important because it is your job later when you become a professional nurse to take care of patients with hypertension. The nursing management of hypertension, of course, goes far beyond simply administering medication. It involves comprehensive patient assessment, education, lifestyle counseling, medication adherence support, and coordinating care across the healthcare team. Whether in the hospital, clinic, or community setting, the nurses play a critical role in early detection, risk reduction, and also long-term blood pressure control, ultimately improving patient outcomes and preventing life-threatening complications. In this session, we will explore how nurses apply critical thinking, evidence-based practice, and also patient-centered care in the management of hypertension. Okay, the first step is nursing management. The effective management of hypertension begins with a true and accurate nursing assessment. As frontline of healthcare providers, of course, nurse plays a vital role in identifying elevated blood pressure early, evaluating contributing factors, and also recognizing signs of potential complication. Nursing assessment is more than just measuring vital signs. For subjective data, as you can see in the slide, involves gathering a comprehensive health history of the patient and also identifying the risk factors like from the family history of the patients, whether the family have um, hypertension or not, and also evaluating the lifestyle habits such as a diet, physical inactivity, potential use of alcohol and also tobacco, and assessing for target organ damage. And also, more importantly, is understanding the patient level of knowledge and adherence to treatment right now. The nurses also gain objective data from head to toe assessment. They are taking vital signs, measuring weight, and calculating BMI because it is really important. As you know, obesity is the major risk factor for hypertension. Auscultate the heart and lung sounds, listen for murmur, gallops, or crackles because it's really related to CAD, heart failure, and also hypertrophy. Check for the peripheral pulse to check for the common complications because as you see before, the common complication is the absence of peripheral pulse and also looking at the lab values that the physician has ordered before to see the kidney function, the lipid profile, the blood glucose, and also electrolytes. It is really important for you to understand the lab values because it shows the extent of this disease going on the patient's body. A focused and holistic assessment allows nurses to individualize the care, guide the patient education, and collaborate with the interprofessional team in developing effective care plans. Okay, so after you do your assessment, the next step is the nursing diagnosis. When caring for patients with hypertension, it is really important to identify nursing diagnosis that guide your care and intervention. This diagnosis help us to focus on patient-specific needs, risk, and responses related to high blood pressure. There are four priority for nursing diagnosis that I take in this slide. The first one is ineffective health management. Many patients with hypertension really struggle to follow lifestyle changes or medication regimens. So, this diagnosis reflects difficulties in managing the heart effectively. It is really important for us as a nurses to understand that health management is a important part of nursing care plan for patients with hypertension because without effective health management, the patient cannot gain or cannot come to the goal of lowering the blood pressure. The second one is the risk for ineffective tissue perfusion. As you know, the elevated blood pressure can impair blood flow to the vital organs, increasing the risk of complications such as stroke, kidney damage, or heart failure. The third diagnosis is the risk for decreased cardiac output related to increased systemic vascular resistance. And the last nursing diagnosis is deficient knowledge related to lifestyle modification and medication management. You need to understand that it may be differ from each person because each patient is unique and it may impact their needs for the nursing diagnosis based on their condition. So please analyze carefully which nursing diagnosis is the most appropriate with your patients you are thinking of later. Okay, next, after identifying the nursing diagnosis related to the hypertension, the next step is to establish a clear, measurable nursing outcomes and goal. Remember the SMART um, Remember the SMART, okay? This guide our intervention and help us to evaluate whether the patient is progressing toward better health or not. Here are the common nursing outcomes and goals for patients with hypertension. The first one, of course, they have to maintain the BP within the target range. So under 130 over 80 mmHg for most patients. Second one, the patient are expected to demonstrate understanding of treatment regimen and medication adherence. Three, adherence to prescribed lifestyle and also the medication. And the last one is prevent complication such as stroke, MI, and also kidney damage, and so on. Okay. Once we have assessed the patient, identified the nursing diagnosis, and set clear goals, it is time to implement effective nursing intervention. These actions will help control blood pressure, promote patient understanding, and also prevent complications. Here are the key nursing intervention for managing hypertension. Okay. The first one is pharmacologic management. As I said before, it's really important for patients to um, to take their antihypertensive regularly based on the prescribed medication that doctors gives. And also I've stated before about the medication classes such as diuretics to promote sodium and water excretion, ACCE inhibitors, every drugs and ends with pril. It is ACE inhibitors. It is to reduce vasoconstrictions. IRB, ARBs is similar to ACE, ACEIs AIs used if ACEIs is not tolerated. The beta blockers reduce heart rate and contractility, and also calcium channel blockers for vasodilation. Every I hi, every medication have its own mechanism of action in the body, so you need to take notes on the side effects of each medication. What is your roles in pharmacologic management? The first one is to monitor for the side effects such as orthostatic hypotension, electrolyte imbalances, and also the teach patient to rise slowly to prevent falls, encourage the adherence to medication even when the patient is asymptomatic. It is really important to give extra education to your patient that they need to take their medication every single day, even though they are on a normal range of blood pressure, because it means that the drug is working, and when they stop the drug, there is the potential to the blood pressure will go high again. And the last one is it's really important also to educate on timing and consistency while taking medication. Example, the patient need to take medication at the same time daily, whether it's on the morning or evening. Okay, the next intervention is lifestyle modification or DAS diet and more. DAS diet is emphasized on fruit, vegetables, low fat dairy, whole grains, and also lean protein. Um, it's really important to restrict the sodium, do the physical activity at least 150 minutes per week based on patient condition. Of moderate intensity aerobic activity is really important for the patient to reduce the weight and also limit alcohol, Tobacco cessation is really strongly encouraged for the patient, and also the stress reduction through stress management. They can try the relaxation techniques such as deep breathing, medication, or yoga. Okay, the next intervention is home blood pressure monitoring. It is really important for the patient to be able to monitor their blood pressure, and also it is really important for nurses to teach the correct use of BP monitor. It must be validated, and how to place the upper arm cuff must be proper, so they can get the valid data of the blood pressure. Also, encourage the patient to um, write the write the blood pressure daily. Instruct to report a very high or low readings to the healthcare providers on their next visit to the hospital or to health facility. It will help to monitor the dynamic that happens on their BP. It is also important to remind the patient about the regular follow-up and evaluation. It is for monitoring the target organ damage. Hopefully, the patient will understand the complication of the hypertension, so they will be more aware that there are the possibility to organ damage, especially in kidney, cardio, heart, and also brain and eyes. It is really important to reinforce lifestyle changes and treatment adherence at each visit, and adjust medication based on BP control and also the side effects. Okay, the last one is about the patient and family teaching. So here is the education topic that the nurses must provide the patient and also family. The first one is the nature of hypertension, whether it is chronic and it is often asymptomatic condition that requiring a lifelong management. So the patient understand that they need to take care the medication uh, for for the sake of lowering their blood pressure. And also they need to understand the potential complication if it is left untreated, like they may have stroke, myocardial infarction, heart failure, chronic kidney disease, and also vision loss. It is really important to teach about the medication instruction, the names of the drugs, the dosage, when and how to take, and also side effects to monitor. Avoid abrupt discontinuation of the medication because there is a risk of rebound hypertension. Give them dietary guidance as you collaborate with dietitian. Label the reading for sodium content, and also some eating out tips for the patient so they don't overeat. Teach them how to self-monitor of their blood pressure and when to call the provider when it comes to the emergency situation. And the last one is really important, to change their lifestyles and adherence even if the blood pressure is controlled. Okay, the last one is the nursing evaluation. Nursing evaluation is the critical final step in the care process. It allows us to determine whether the intervention that you've implemented before have been effective in helping the patient achieve their blood pressure goals or not, and also to assess the overall health outcomes. When evaluating a patient with hypertension, we can focus on several key areas. The first one is the blood pressure control, whether the patient has reached the target consistently or not. Look at the medication adherence, whether the patient also uh, do the self reports, they can count the pills correctly and also refill the rates. Um, and hopefully the patient can take the medication as prescribed. For the dietary compliance, we hopefully we the indicators is the patient are reporting low sodium intake and also taking food diary with the criteria of they follow the DAS or DAS management or equivalent. For the knowledge level, the patient can verbalize and also return demonstration about all the um, healthcare, about the health education that we give before, with the criteria that they can accurately explain the treatment and risk. For the lifestyle modification, they report their physical activity, weight loss, and also smoking cessation with the criteria of they maintains healthy behavior. For the symptoms monitoring, they can report if they have headache, dizziness, or vision changes, and they most important know when to seek help. And the last is the complication prevention. You can look at the lab values, ECG, renal function, and also retinal exams. With the signs of with the criteria of no signs of an organ damage. Okay, that's the end of our video lecture. We covered the key points on nursing management for hypertension. I hope it helped you understand the topic better, but please take time to review what we've discussed, read your textbooks, and feel free to revisit this video whenever you need a refresher. Thank you for watching and see you in the next video.